Yeah, hey, welcome everyone. I guess I'm wearing a lot of hats today. So I'll be introducing people and doing the keynote and also moderating the panel. So welcome everyone. My name is Uli Chettipally. I'm the founder of InnovatorMD. But my background is I'm an emergency physician. And today I'm going to talk about why I think physician innovation is important. What does physician innovation mean and how you can get into physician innovation? Most of my career has been as an emergency physician. Let me get this going. Okay. So emergency physician, most of my career was with Kaiser Permanente as emergency medicine, mostly on administration track. I was the chairman of the department for several years. And then I kind of got bored with the administration part. And so I started doing projects. I did a startup during the dot-com boom time, took a year sabbatical and did that. Of course, it crashed with the market, but that was my introduction to entrepreneurship. I also did some projects at Kaiser, most notably co-founded a research network where we designed and developed a decision support platform on top of Epic. And that was a big hit. We won some awards, and there are about 14, 15 physician scientists working in that group at this point. I left clinical practice and I started InnovatorMD. And the reason I started InnovatorMD is because I felt that while I was being a physician and trying to innovate within a system, it was so hard. And I couldn't imagine if you're outside a system and if you're doing it independently, how hard that can be. So that's number one reason, which is I wanted to help physicians do innovation better than what they've been doing. Number two was I wanted to learn. I wanted to learn more about entrepreneurship, innovation, and also wanted to see what is out there. What are the things that are happening in the market? Where are we? And I wanted to learn. So InnovatorMD was a great way to create that community, which is where people can come and learn from each other, connect, and also be able to collaborate amongst each other. That was the main purpose. And then this year we started an accelerator with Founder Institute. And so if you haven't seen the ad for that, you should check it out, fi.co/help. So we are starting an accelerator, mainly pre-seed accelerator. This is a virtual accelerator and it is a global accelerator. So people from all over the world will be applying for this. So if you want to be a mentor or if you want to be a candidate going through this accelerator, please email us. And then last year, I founded Sirica Therapeutics. So this is my baby startup. I'll talk about it a little bit later on how it happened. So why do we have to do innovation? Most physicians are happy with their jobs, getting their paycheck, just do their 60 hours or 80 hours a week and be happy with the payment, and everything will be fine. You're paying the bills and you're taking care of your profession. Some of us want more from our professional life and personal life, right? Some of us think that we can do more. If you have been in the business, if you have been in the healthcare business, if you have been practicing, we know all the problems that are there in the healthcare industry. So, I'm going to highlight a few, but you will know what these are. you look at the big picture, people are getting older. So when people get older, the cost of care goes up. When the cost of care goes up, we have to start worrying about rationing care, the quality of care, the access to care. So those are all some of the big problems that we'll run into. And as you know, we are spending almost $4 billion a year on healthcare. And that is as big as the fourth largest economy in the world. It's as big as Germany. And the cost keeps going up. And if you look at this graph, healthcare is way up there compared to other consumer prices, right? If you look at housing, food, transportation, clothing. The other, I should say, the other industry is education also is getting very expensive. But healthcare has the most overall inflation. But the quality of healthcare has not been that great. If you compare us with other countries, other developed countries, we are spending more, but the performance is much lower. So is that a good enough reason? I would say yes. If you want to make healthcare better, or if you want to make the world a better place, if you want to help patients, innovation is the way to go. And the reason for that is when you are practicing, you're helping one patient at a time, right? So you're spending a lot of your time helping each of these patients, which is a great thing. I'm not saying that that's not good enough. What I'm saying is, if you can influence or help more patients, maybe 1,000 patients at a time, or maybe 1 million patients at a time, right? That is only possible with innovation. Whether it is innovating on the business model, innovating on a new service or a new device or a drug, that's how you help more patients. The other thing, what I've noticed is that as you start practicing medicine, especially if you're a specialist, right? You're seeing the same patients over and over and over again. Sometimes that gets boring. And sometimes, the problems that you see are always there. It's the same problems over and over and over again. And sometimes you think, is there a better solution for this? Is there a better way of dealing with this? And as far as your own mission in life, you became a doctor or a nurse or a pharmacist because you want to help people. Of course, you want to make a good living, a stable living, but the mission itself, if you are just there for the money, you cannot survive being a physician. You cannot practice. You cannot be happy practicing, being a practicing physician or a nurse. You got to have something more. You have to have your heart in it. Now, when you think about physicians, they have spent years, if not decades, training, going to medical school, taking all the tests and going through the residency training, right? And some people think that, if I have done all this time, if I have put in so much effort, if I have put in so much money into this, I better be practicing, which is true, which is a good thing. But also some people think, if I stop practicing and do something else, that is kind of a betrayal to my profession, or that is some way of not giving back to the community that actually helped me learn, helped me develop my skills. And I don't have any problem with that kind of thinking, but if there is a better way to help patients, I would say I would do it. And that's what I did. I think I can help patients better by encouraging physicians who can do much better than just seeing one patient at a time. And that's our mission at InnovatorMD, as you have seen. So what does it involve? Well, the first thing is you have to see where the money is. Where is the money being spent? Usually people think that the more money you spend, the better the quality of care is. That's not necessarily true, especially in American healthcare, right? So the biggest chunk goes to hospital care. Now, hospitals is the most expensive place to get care. And there are several reasons why, but that has been a target for many of the startups, many of the innovations. How do you prevent or decrease hospital expenditure? Physician services comes next. Well, actually, it's other personal health care, but that's out of pocket, what patients spend. But if you look at the organized medicine, organized healthcare industry, physician services comes next. And then clinical services, everything else that goes with it. Whether it is labs, whether it's x-rays, and all those services, physical therapy. Nursing homes, home healthcare, that is a significant chunk. Prescription drugs is a big chunk, about 10%. So if you look at this pie chart and you have to think about, okay, where can my innovation help? These are the big chunks of expenditure. Where can my innovation help, whether decreasing the cost or improving the quality? I stole this concept from Hari on LinkedIn. He posted this, not exactly like this, but he divided areas into technologies, products, and services. So when you start thinking about where do I innovate, first, you start with the technologies. Are there any technologies and new technologies that are going to help develop new products or new services, right? For example, digital technology has been very, very, powerful and helpful in improving the services. Communication technologies, the cell phone, new materials and new molecular technologies, they have been very helpful in the healthcare industry, the life sciences industry. Now, can we build new products from those technologies? Can we use digital technology to develop new drugs faster? Can we develop, communication technologies to help design better wearables, right? Or devices or implants. So those are the product areas that you can look at. And then ultimately the services, that's where the rubber hits the road, right? Where the patient and the physician interaction happens. Now, when you look at the whole healthcare industry, there are two important people: the physicians and their teams, patients and their teams. So without these two groups of people, there's no healthcare. But these two groups of people bear the brunt of an ineffective and inefficient healthcare system. So that's why I'm so focused on physician innovation and provider innovation, because that's where you can make the biggest difference. And you can divide the services into, there are many more subspecialties: primary care, diagnostics, and hospital, right? These are the big ones. But there are many more smaller areas of service. Now, as far as services are concerned, how do you make a difference there? How do you innovate? Can you create a new business model? Like telehealth, it's a new business model, or direct primary care, or hospital at home, or home-based testing for diagnostics, right? How about creating a specialist group that can practice over multiple states? So there are different ways you can innovate in the services sector, but the technologies will flow into products and services. So in a way, when you innovate, you have to think about the technologies as the base. That's where you have to have some proficiency so that you can improve the services and products. Okay, the second big thing that we need to keep in mind is the business model of healthcare. Are you creating something for the volume-based care, or are you creating for value-based care? The other day, a physician came to me and said, hey, I made this product for cardiac patients, right? Now, the question is, it'll keep the patients healthy, it'll prevent them from having heart attacks, but how will that affect the healthcare system? Will the hospital like it, right? If you're saying that you're going to prevent heart attacks, will the cardiac cath center like it? Will the cardiologist like it? Will the people who provide drugs for heart attacks, will they like it? So you have to really think about how your product or service is going to affect the rest of the healthcare system. It is true that you can, create disruption and create value in your innovation and startup. But if it's going to be using the current system, you will find that you will have a lot of hurdles. You might hit a brick wall because your innovation doesn't fit into the current system. That does not mean that you should do something just for the sake of, generating money, but it has to have an overall value to the patient and the providers. The other thing, as care goes from home, from the community into the hospital, the patient gets sicker and sicker and the cost goes up. So how do you move these services upstream? That's another way of looking at innovation. Okay, so we've talked about why, and we've talked about what. So let's talk about how. We at InnovatorMD, we want to make sure that, when you come here, we want you to learn. We want you to understand how the innovation economy works, how the innovation ecosystem works. So there are a few things that you have to consider when you're innovating. Is your product or service, is it going to be from a business to consumer, or is it going to be from a business to business? For example, if you're doing home testing, are you selling the home test to consumers on the internet, or are you selling that to clinics so that the clinic will again sell it to consumers? That is B to B to C. Or there's another business model where you can sell it to consumers first, and as the consumers understand the value, the businesses will start to look at the value and say, hey, we want that for our business. So there are some companies that provide this kind of a transition where they want to start with the consumers first, and then the consumers, employers or the payers or the insurance companies, they will start looking at this, hey, there is something here, and then they'll start paying for it. So the business model. The second thing is you have to identify who the users are, who the payer is, who is going to implement it, and who is going to influence that decision to buy. And all of these people could be the same person, or it could be different people, right? Different entities. It could be a pharma company buying your tool so that you can use it in the hospital so that the nurse can use it on the patient. So there, the payer is different, the influencer is different, the implementer and user. So make sure that you identify these pieces. And there may be other pieces too. These are the big ones that I identified here. So who is going to use your innovation? Who is going to pay for it? And who is going to actually implement it? And who can influence that decision to buy? So the best way to learn is by doing and by teaching, right? And that's what we do here. When I wanted to learn about innovation, that's what I did. I said, okay, I'm going to invite these people to come, these experts to come and talk about it. And that's how you learn. And then you start doing small projects. And then you start teaching it to others, right? See one, do one, teach one. That's what we learned in medical school. But here, as you learn, you're also doing. As you're doing, you're also learning. So it's a continuous cycle. And you can start anywhere you want, right? You can start with the learning part, or you can start with the doing part or teaching part. But we at InnovatorMD, we want to create that whole ecosystem where you can do any of these things. The other thing you can think about is, what kind of role would you like to play? Would you like to be an advisor? That's a good way to know how the startups are working. Can you be an investor? An angel investor can invest anywhere from $25 to $50 to $100,000 and actually get a front row window seat to see how innovation is happening. Or you can join the startup as a chief medical officer, and ultimately you can even found or co-found a company with other co-founders. I wanted to end with this example of, I've been seeing so much innovation. I've been talking about innovation. I am also doing this innovation. So this is my startup. It's called Sirica Therapeutics. We are building a robotic device with virtual reality and video gaming as a therapeutic device, therapeutic system for autism. I have a daughter, her name is Siri, that's her, and she has autism. So I thought, okay, I got to do something in this field. So here it is. So as you can see, the machine is moving. It is just an exercise machine, but it's also a robot. And the robot actually the VR puts you in the video game. So you're actually driving this vehicle. There she hit a rock. And whenever you do that, you actually get haptic feedback into the machine. As you can see, the machine is moving. When you go over a bump, you can feel it actually going over a bump. So what that does is that puts the patient into deep immersion. And when you provide a task-based therapy and you feel the urgency, that will engage the patient in this and engage the brain cells. So our hypothesis is that this will create neuroplasticity. This will create neuroplasticity, and hopefully it will decrease the symptoms of autism, which is anxiety, which is motor behavior, which is aggressiveness, and improve focus. And that's what we are doing here. Thank you for joining us today. InnovatorMD is the largest physician innovator platform. We want to encourage physician innovators. And that's my book about promise of AI. And I'll take questions now before we go into our startups. So I'll stop sharing here. Okay, any questions? We'll have time for maybe a couple of questions.
Uli, I have a question.
Okay.
On the investor side, as a physician, like how many angel investments do you see like you and your colleagues typically doing, and how many investments end up having one be successful in your experience?
Sure. Who is this, by the way?
This is James.
James, I can't find you here, but
James,
okay.
I'm one of the residents, so I don't have any disposable income to be an angel investor.
Okay, so yeah, so one of the things that people do is, you either, okay, I'll tell you what I do, right? I see about 150 to 200 startups a year. Out of those, I pick 40 or 50 of them to come present, which means that, I get a deeper understanding of what they're doing. If I like the team and if I like what they're doing, I join them whether with my time or as an investor. Typical investments, like I said, can be anywhere from $25,000 to $50,000 or more. But I do one investment a year because I don't have much money. But if I had, I would do more. And that is my personal portfolio. Typically what I try to do is I try to keep my portfolio to about 5% of it going into investments, startup investments. And the usual numbers are that 70% of the investments will fail, which means that this is a very high risk investment, right? Startup investment is very high risk. The typical numbers are, 2 of the 10 will do okay. That means you'll get your money back and maybe a little bit more. 1 out of 10 will be a good success. Maybe 2 to 3 times of your investment will be back. But if you're just, or it could be 100 times your investment, right? If you're just investing as a, just for the money's sake, you better have a lot of money, because and a full team and a great and partners. So in other words, you have to be a VC company or an angel group, right? You get collective intelligence there. But if you're an individual investor, you're not investing for the money, you're investing for the fun. So this is like the play money that you can use to invest. And also you learn, right? It'll engage a different part of the brain that you never thought existed.
Well, thank you for sharing your own kind of personal investment strategy and everything. So
Sure.